Yes, welcome again. Today is on Monday. We have been a bit late, but I think we'll do something. Our topic of the week is anemia. Everyone talks about low blood, but we want to know what exactly anemia is from the real concepts. We have always gone to hospital, especially women that are pregnant. Women that are pregnant, and they have been told you have low blood. Uh, is it really having low blood, or is anemia some other thing? As Miriam Mumbwa is hello, says hello. Yes, I hope you are good wherever you are. And today we want to talk about anemia. We want to understand what anemia is. So, in real sense, anemia is a condition whereby your blood does not have enough. Your blood is made of several things: platelets, white blood cells, erythrocytes, T cells, all those, plus the plasma itself. So we have this component of blood called the red blood cells. And I'm sure everybody has been talking about what is anemia. So let's go down. We see the components of blood. What does your blood have? We have said we have uh, the watery part, which is the plasma. We have the platelets. We are going through the components of blood so that we can know what we are dealing with. See, this question is a funny question where a person tells you, I was in the hospital and I was told I have low blood, and they quickly say that you have anemia. Now, blood contains plasma, about 55% of it. The watery part plasma is about 55%. We have the red blood cells. The medical term we call the red blood cells is erythrocytes, which carries the oxygen, and that one is the concern of the day. Now, that one is what we are going to talk today. And then we have the white blood cells, the normal medical word for white blood cells, we call them leukocytes. The platelets. Platelets is another component, that is the fourth one. The platelets, the medical term, we call them thrombocytes. Thrombocytes. So when you hear about thrombin, just know we're talking about clotting factor and platelets. And then we have other things in your blood that we will not mention today, but when it comes to general discussion about blood and its components, we will talk. So you remember about platelets, red blood cells, white blood cells, platelets, because under white blood cells, we have other more cells differentiated. So today we are talking about anemia, and we have said it's a condition where your blood does not have enough healthy red blood cells or hemoglobin, the one that we have said they are called erythrocytes, to carry oxygen to other parts of your body. You see, you have very many components in your blood, all that we have named three, but under those they are subdivided into others. Like the white blood cells are subdivided into others. But we have this component of blood called the red blood cells. We call them erythrocytes. Their work in your body is to carry hemoglobin. They fuse with hemoglobin, and they go around the body and they deliver oxygen to tissues. So when you have less of these cells in your body, when you have less of this, you see, when you have less red blood cells surrounding in your body, that is where we say you have anemia. But you can not just rule out anemia by having less, because there are so many types of anemia that we will talk about. What we are saying right now, we need to know is what happens and what causes this thing called anemia. Because you have said it's a condition where you have less red blood cells in your body. You see, this is a condition where you have less blood cells in your body. But what happens? What causes it? Let's go through it so faster, and then we categorize anemias, because now that we are talking about one component in your blood which is called the red blood cells that delivers oxygen. Yes, let's talk to causes. One, iron deficiency. If you don't take enough iron, the the work of iron is to manufacture the red blood cells from your long bones. You get it? From your long bones. And then they be delivered where? To the blood. We will see that how they are manufactured as we go on this week. This is a week of anemias and the causes. Now we go to vitamin deficiency. You're not taking something called B12. Mavia V is saying hello to me. Yes, where are you from? US? Yes, yes, we'll know. Hi, hi, hi. We have vitamin deficiency and B12 or folate. When women are pregnant, oh, Mafia, I see you're from Canada. That's nice. Is it cold where you are right now? Okay. Now, when women are pregnant, they are given B12 and folate. It's because of something called differentiation in something called embryology. When the baby is growing, we will see one day why. But B12 that you take from vegetables, from meat, from 17. We are sorry about that. I saw that. Uh, I saw that. Sorry about that, Mavia. But welcome to the platform. Let's learn about anemia. Now, B12 has a part that it helps. So if you have a question today, please don't fail to ask a question as we go on. Ask a question. Let's get to learn as we move on. Now, I've said B12 helps in making red blood cells. And then we have sometimes blood loss. Some in women, heavy periods, ulcerations in your stomach, and maybe your cut, and then you're bleeding. Chronic kidney disease and infection. Your kidney has a hormone. Mafia, sorry for the season is passing. Yes, yes, sorry for her, for him. It's okay. Chronic diseases for the kidney. The kidney has something called it produces something called erythropoietin. It's a hormone that stimulates production of red blood cells. And then we have inherited conditions like sickle cell. Sickle cell are cells you're producing red blood cells that are not mature, and those red blood cells cannot carry. They are sickled like this. They are sickled. They look like this. If you look in a microscope, they are semicircular. So they cannot carry oxygen. Somebody asked me why are people who have sickle cell anemia, they can't get malaria. It's because the parasite cannot get inside that cell. It is sickled. Inherited conditions like sickle cell causes anemia, and then we have bone marrow problems. It's like the places where you manufacture the places where you manufacture red blood cells, they are destroyed because it's the industry. The long bones inside the long bones like femur and humerus here. These are the bones that give you red blood cells. There is the engine where they are manufactured. Now we continue. Like I'm just giving an overview of anemia. Now we have common symptoms like Dorothy, you're making noise for me. Now we have common symptoms like tiredness and weaknesses. Tiredness, these are symptoms of anemia. We have pale skin or lips. Pale skin or lips match when they turn blue. When you see bluishness around your lips or your palms or your sclera is the part of the eye down here, you know you're not getting enough oxygen and you need to be checked. You have dizziness. Dizziness comes because of low oxygen that goes to your brain. And then you have fast beating. The heart compensates, so it beats fast. Can you get enough vitamin B12 from certain food or you must take the supplement? Yes, that's a good question, Mavia. It is good to take natural uh, B12 from foods before you get to supplements. Supplements are industry generated, and they have more other things inside that maybe you may be allergic to. But I usually tell people to get more vegetables, foods. We will see which foods can give you vitamin B12 before you get to supplements. But supplements are not bad at times. It's good. But if you get the food, if you are healthy and your body can break down the food you eat and get the B12 by itself, it's better than taking the supplement. You get it? We will see which foods can give you those vitamin B12 and even folate. It's not only vitamin B12. Yes, we continue. You have said your heart will beat faster. These are common symptoms when you have anemia. Your heart will beat faster because it will be compensating on getting oxygen to your brain. If it's normal, let me explain this in simple language. If you have like uh, 6 cells that are normal with enough oxygen that deliver oxygen to your brain and tissues, and you are healthy, you are okay. But if they have a problem, you need more than 6, or your blood, your heart needs to pump faster so that it can get oxygen from your lungs faster to deliver to the. That is where we call tachycardia or fast heartbeats. So when you are having anemia, there's a condition whereby you'll find your extremities, like the hands and the legs, they are cold. We will see why. Because even these red blood cells, they have a way of keeping you warm. We continue. How is it diagnosed? How is it diagnosed? When you go to a hospital and then they do something called full blood count, we will see the components of full blood count. Today, we are doing what? We are introducing something called anemia. Just going overview. So we will introduce something called full blood count. There's something called microcytic count, iron studies like ferritin. Ferritin, I know you don't know it by now, but as we continue, we will know what ferritin is. Is anemia serious? It is. It is very serious. It depends with the kind of anemia that you are having, because some kind of anemias are not serious and they can be corrected with only food. But there are some kind of anemias that are serious and they can be taken. They can be fatal. They can be fatal. So we have gone up to there. We need to see and find out how to classify anemia. We don't just say you have anemia. No, we have to know which kind of anemia do you have, because losing blood cells, the red, we have talked about the red blood cell. We are talking about the red blood cells that circulates around your body. You get it? The red blood cell. And this red blood cell, you know how it goes? It goes to your heart. From the heart, it goes to your lungs. In the lungs, it is given oxygen. It goes back to the heart. After the heart, it is pumped to go around your body to deliver oxygen to various tissues. So what can make this process not to be okay? What can make this process not to go on as needed? This is where we classify anemias. This is where we classify pathologies, the problems. Now, we start with the first one, which is called microcytic anemia. Microcytic anemia. When you just hear you've gone to a hospital and then you have written there microcytic anemia, know this: iron deficiency. You don't take enough iron. So your red blood cells become small that they cannot even carry enough oxygen. We have some things called thalassemias. Those are cancers. They are under micro. When you hear anything micro, we are in the first part of classification of anemias. When you hear something called micro, no, it is small. So microcytic anemia, they can be found in thalassemias, which are cancers. You are iron deficiency anemia, where you are not taking enough iron from foods that we eat. Anemia of chronic diseases like kidney diseases. We have said the kidney produces erythropoietin that helps to produce red blood cells. Cerebro- Sideroblastic anemia. You see, those are tumors. Lead poisoning. When you get lead poisoning, the process of manufacturing red blood cells becomes a problem. This one, we have classification by red blood cell size. The size can affect, because if your red blood cell is small, it will not carry enough oxygen. We have the normal one, which is called normocytic anemia. Normal. It is normal, but what is happening? You have normal cells. Normal, they carry enough oxygen, but the problem is you've cut yourself the major vein and you're bleeding. You don't have enough cells. That is normal, but you are bleeding. And then chronic diseases like ulcers, people that bleed with ulcerations in the stomach. You are always taking supplements, but you have wounds in your stomach that are bleeding, and you're going to your stool is dark. Your stool is dark. We call it melena. You definitely know you have anemia. You need to be treated those wounds so that you cannot bleed. Those ones are normocytic anemia. Chronic kidney diseases. Kidney is the pillar of your body. It produces enzymes, no, hormones that help you. You remember how we discussed about blood pressure, how the renin helps in blood pressure from the kidney. Now we are talking about another thing called erythropoietin, a hormone that your kidney releases and tells the long bones, please start manufacturing red blood cells. Please do it, because we don't have enough in stores. So this, if there is no this hormone, what will happen? You will not manufacture enough red blood cells. So the kidney is the motherland of anemia. Now we continue. See, macro anemia. Sometimes you can, when you hear about macro, big, we've just talked of micro. Miriam Mumbwa, yes, thanks for that. Yes, thanks. And everybody you see, Miriam Mumbwa has good work that she's doing. You, after this, you go and see that. Now, macrocytic anemia. You are taking vitamin B12, but that is not enough. You don't have folate, enough folate in your body. And then you have something, maybe a cancer or some autoimmune diseases like arthritis, and you are using a drug called methotrexate. You are using methotrexate. Methotrexate makes your red blood cells to be big. They cannot be, if you have big red blood cells, they'll transport oxygen, but they'll not be enough, because red blood cell only carries two oxygens in one. In one, let me show. Red blood cells like this: oxygen, oxygen. This is iron, ferrous iron. It carries like this way. I don't know if someone is seeing. Yes, like that one. So if you're having big red blood cells because of B12 deficiency, folate deficiency, it's only big protein. You know, it's your red blood cell is made of hemoglobin plus a protein. So when it gets the oxygen, it turns to oxyhemoglobin. So if that protein can be big, that cannot carry enough oxygen. It is only a protein. And methotrexate as a drug, for the people who are arthritis positive and are using this, if you find yourself having anemia, just know that methotrexate is helping the red blood cells to grow bigger. That's why we are saying macro, big. So non-megaloblastic anemia. This one, there are some things that we do for ourselves that we can find ourselves getting to anemia that is called microcytic, like taking a lot of alcohol. Alcohol hinders B12 deficiency and folate absorption and folate absorption. So you find yourself having B12 deficiency. You see, so we reduce there, and then hypothyroidism. People that have problems with the thyroid. Thyroidism, the thyroid is used in hemostasis. It controls your temperature, it controls some hormones to come out, some hormones not to come out. So this problem may be brought by hypothyroidism. We got myelodysplastic syndrome. We will see what is that. It creates bigger red blood cells syndromes and even liver diseases. Liver diseases. But you see, alcoholism causes liver diseases, so you relate. Now we continue classification by cause. We have said today is introduction, and the week today, this week is for anemia. By Friday, we should have known everything about anemia, then categorize them, and know how to treat anemia. Now, blood loss. We can lose blood. These are classification by cause, the cause of anemias. You see, uh, you can have acute hemorrhage, nose bleeding, that is hemorrhage, heavy menses, that is hemorrhage. You see, bleeding from your stomach, people who have bad ulcerations, that is bleeding, trauma, and then you are cut somewhere, that is bleeding. You see, several things that can lead us to bleeding. Mm? And then we have decreased red blood cell production by causes. These are by causes. You can have iron deficiency because without iron, you will not manufacture red blood cells. We have bone marrow failure. When you hear about bone marrow failure, it means your bone marrow is not working out to produce enough, enough, enough red blood cells. Because without, let's say, without iron plus erythropoietin from your kidney, you will not find you will not find a way to manufacture the red blood cells. See, you will not find a way to manufacture the red blood cells. So it is important we know iron is important. When eating your food, sometimes make sure some iron component is. And when you're feeling dizziness, you see we started by the symptoms. Vitamin B12 and folate deficiency. I think we should have a day this week where we are discussing how folate, yes, y- how folate is, yes, okay, so, okay, let me call. So, we talk about increased red blood cells destruction. Sorry for distraction. When you have the red blood cells that are being destroyed always. Hmm? The red blood cells that are, and how can they be destroyed and they are in your body? They can be destroyed when you have conditions like sickle cells. You see, sickle cells, you have seen some people are born with that disease. Hmm? And then there is a deficiency of a hormone called G6PD that helps in manufacture of red blood cells. You see, it is destroying, you are producing and they are being destroyed. You are producing and those cells are being destroyed. So it means you will have anemia. You will not have enough red blood cells. Hmm? So from today, I hope we understand. We will not be speaking the language of I went to a doctor, a hospital, and I was told my blood is low. No, We are talking about the red blood cells itself. Hereditary spherocytosis. Spherocytosis is some people are born by uh, a condition whereby they produce some cells that are not normal. You get it from your parents. Extrinsic, and there are some things like malaria. We call them extrinsic outside RBCs. Malaria is whereby mosquito gets the parasite like the ovale malariae, you get it, and then it bites a healthy person. Now, that parasite gets to your red blood cells and then it destroys it. When it destroys it, that's why you see people that are affected by malaria or liver diseases, their eyes are yellow. Why? Because your cells produces something called bilirubin when they are destroyed. Bilirubin plus the globin, which is the protein. You see? So malaria can be part of it. Autoimmune hemolytic anemia. Autoimmune. When you hear about autoimmune, you know that something one your cells are fighting against your cells. So you can have a condition whereby part of the cells you have in your body are destroying the red blood cells. We will see how. This week is a very long week and we should learn. We should continue and learn about all this and how they are being destroyed so that we don't, when you have a patient of anemia, the first diagnosis, you see that patient and you say, this is this, I need to give this. Because when someone is suffering from megaloblastic anemia and you're giving ranferon the eye, you see sometimes you may not be doing right. Someone is having pain because of sickle cell anemia and you are always giving blood, you're not helping. We will see why. Mechanic hemolysis, prosthetic valves. There are some valves that people get, like stents. We have the stent or the drainage stent for the brain. We have the stent for the heart. We have the stent, so many that are put on in your body to help you live normally. They may destroy your red blood cells because when they pass there, they burst. These things help you, but they can bring other problems. We have talked about cancers, let's say like sarcoidosis, amyloidosis, you see, lymphomas that can cause your your production of the red blood cell to go down. We will see all those special named anemias like sickle cell anemia, aplastic anemia, pernicious anemia. When you hear about pernicious anemia, just know we are talking about B12 deficiency, lack of intrinsic factors. Intrinsic factors we will see. Hemolytic anemia, where they are bursting and destroying themselves. Anemia of chronic diseases like kidney disease, iron deficiency anemia. Those are anemias. You get it? Now, today it has been a very short session, and I want you to go home with this. It is very important. How can you know that someone has anemia? Before even you know you go to a hospital. How? I know some people say that they know about dizziness. Hmm? Dizziness alone does not rule out anemia. What else can we know about anemia? Symptoms. The first symptom is it is always fatigue and weakness. You feel you're bored. You are always tired. You don't want to do anything because when your muscles and your tissues are not getting enough oxygen. You know, when you get oxygen, it is the key point of production of what? Of energy. Because oxygen plus ATP, which is in the mitochondria, is what gives you energy plus glucose. You get it? So we find some people getting shortness of breath, mm, headaches because of lack of enough oxygen to your brain. Palpitations. Palpitations means your heart also. You see, your heart, as it pumps blood, it needs the oxygen and energy, and it has a blood supply called the carotid artery that supplies blood through the heart to give it oxygen, glucose as energy. So when it's not receiving the same, what does it do? You get palpitations. And as we go on, today we have been late. Please put on your questions. We answer them as we continue, or a concern. If you want to say something more about anemia or an experience, put it here. We discuss. Today it's about 6:39. Oh, we have gone around 32 minutes. Yes. Palpitations, your heart. But palpitation means your heart beating fast. You've just seated down like this, you feel dizziness, and then you see your heart is beating. Shortness of breath, mafia. Eat vegetables from brassica cruciferous genus such as kale, cabbage. Now, I am seeing Mavia is giving us a true talk here. He is saying you eat these vegetables. I am sure everyone can see them: garlic, seafood, eggs, amaranthus. Eat organic and processed foods. Very important. Organic food is good. And what you've just put there, which is called broccoli and cauliflower, these things are very good when it comes to iron production. Iron. And without iron, you don't have red blood cells. So everyone go through that. What Mavia has written, it is very important. Very important. But I'll talk about cabbage. There is something I'll talk about courage, and we will. Cabbage is not a real thing. Someone told me is a clone of the normal kale. I'll talk about it when time comes. Now we were talking about the symptoms and about the palpitations. Those are the symptoms, and then we have the signs. The signs that you can look at someone. Today we are just having an overview. You get it? An overview of how you can know this person has anemia and what is anemia. Now we have some signs when you examine someone and then you look at this person and then you say, this is anemia. Let's rush to a hospital. Rich Siku, Benjamin, welcome, Rich. Pale skin and conjunctiva. Sometimes when you look at a person, you see this person is weak. You check at the hands, palms, the palms, you find that the palms are bluish. You have ever seen a person and you see the palms are blue. You look under the conjunctiva, you do this, and you see bluishness. That is a sign of red blood cells that has no oxygen. Red blood cells that has no oxygen. So you'll definitely know this person has anemia. Let's lie. Great health insight today. Yes, Rich you. Sue, yes, great Sue. Welcome. Tachycardia. Person is very weak, is bluish at the conjunctiva and the hands, and then this person's heart is beating so fast. And why is it beating so fast? It's because it is compensating, it is pumping very faster so that the little oxygen is getting from the lungs to be delivered to tissues and the brain. And the brain uses a lot of oxygen. The brain is the core factor of your living, you as a body. So it needs a lot of oxygen. And then we see when you go to the hospital, they do their workouts, they find you have what? Anemia. You have low hemoglobin levels. Now, there is some things that you can undergo and they may cause problems like infections, white blood cells infections, immunity problems. You have immunity problems. Always you are having infections, they can destroy your red blood cells. Fevers. chills, sore throat that are not, when you have low in you have when you have infections, your immunity, concurrent infections, it means your immunity goes down. And we talk always, we associate with our friends every time. So the first place that you will get infected is your throat because of inhaling and exhaling. That's why you see people that have low immunity, they have flus every time. We are living in a world of bacteria everywhere. You cannot go away, but your body, the way it is created, God was a very genius one. He created your body whereby even if you get the infection, there are some things called the Mark 2 and Mark 3 under the complement system. They usually remove them if your immunity is okay. We will talk about the complement system when time comes and know how your immunity works. Now, sore throats, those ones we have talked about, always having mouth ulcers, poor wound healing. You are given medications and your wounds are not healing. They can destroy the red blood cells. And then sometimes high white blood cells. Having so many white blood cells is a sign of high infection. You will be having fevers, body aches, night sweats always. Hmm? You see, night says, why do you have night sweats always when you have problems and infections? Because when you're going to rest is when your body is metabolizing and doing some other things. That's when you will find most of the time children at around 2, 3 in the morning, that is where problems starts to come. You get it? And then we have the signs that you should look at and know there is a problem. Maybe you have infection, your tonsil nodes swell, your tonsil nodes swell, your spleen, when you touch here at the left quadrant, you feel something is bigger there. So this one is where what we talk about. You have splenomegaly. So the spleen normally filters, the spleen filters the dirt that is in your, it is involved in immunity that is circulating in your body. Dead, dead viruses, dead bacteria, destroyed cells, all the tonsil nodes, the axillary nodes, the inguinal nodes, all those help the spleen or the lymphatic system to drain the dirt that you have. You see, now we have something called the platelets, bleeding disorders. Bleeding disorders. They can cause you to have problems. There are some bleeding, people are born with bleeding disorders. You brush your mouth and then you see blood on the toothbrush. You may be suffering from something called thrombocytopenia, which is low platelets. And you see, if you have low platelets, there is a problem with bleeding, nose bleeding, easy bruising, heavy menstrual bleeding. These are the problems that we face always, and they should be corrected. And then when you have high platelets, sometimes you'll get some headaches, you'll get dizziness, you'll get sometimes no symptom. Sometimes heavy platelets can be a problem because of clogging of the cells. Heavy platelets might be a problem. Risk of abnormal clotting. When you have many platelets, you see, platelets help you because when you're cut, they help to form a, a clog there so that you may not bleed for long. Mr. Beth, hi, welcome. Welcome. We're talking about anemia. If you are late, please you start from the beginning. Now we have prolonged clotting time and hematomas. These ones, bleeding, they cause clots inside your body. See, this can be a problem. So it's a nice topic for today. And you see, the introduction has taken more than 41 minutes. So from tomorrow, we will understand so many things about macrocytic anemia, and classification, how blood loss, how, and we need to know. I think from tomorrow we will talk about how the red blood cell is manufactured. So that you see, when you know the normal thing, you will know how to correct it, or you will know how where the problem comes. We will know how the kidney helps in production of red blood cells. We will know how the bone marrow hmm, helps in production of the red blood cells. And you've seen even the thyroid. The thyroid helps in production of the red blood cells. So this is a multisectoral thing in your body that helps everything to come out. See, it's very important. So wherever you are, I've said we ask any question. I can see there is no more. I'm giving some 2 minutes for questions. If anyone has a question, let's put it right now before I go. We have seen here Mavi has advised us what to eat, which is important. What I'm putting pending there is cabbage, but there is a strong point that he has said eat organic and processed food. That is very important when it comes to anemia. You get it? Mm, yes, it's very important when it comes to anemia. So, any question before I log out? If anyone has a question or any proposal or anything that you want me to reframe, remember this is just an introduction. We have a long way in the week to understand what is anemia. Any question? Nice one. Nice one. Maybe someone is still typing the question. Let me wait for a minute before I close. Close, I'm sure. This means that our introduction was very nice and everyone has understood about anemia. We have said, let me repeat, anemia is not low blood volume. Anemia is low blood red blood cells to carry oxygen to the brain and tissues. So when it will come to yes, Uncle from Jamaica, Jamaican uncle. Yes, uncle, welcome to the platform. Today we have been so late. We have been discussing about anemia and its introduction. Introduction. I've seen some people are liking and giving thumbs up. I think the introduction was good. Even Uncle does good work. You can listening in the background. You can check out Uncle Kish Kish is here. Yes, Kish Kish is here. Yeah, and so we have said we reason about blood volume and anemia where it comes to the red blood cell. We are talking about the red blood cell. That's why I talked about categorizing what the blood itself has. You get it? So, everyone who is here, if you have a proposal, you can put it, and you know the email address where you can send questions and your proposals. Let me repeat again. Any private concern should be uh, sent to that email. Remember to put your number so that we can converse. Thanks a lot for signing in. Have a blessed day. I'm saying we don't have questions today. Welcome. Tomorrow we are dealing with how the red blood cell is manufactured in your body. So as we talk of other anemias, we'll be connecting. Share and like. We meet tomorrow at 4:30 as usual time.